afternoon, everybody. Thank you, and welcome to Doctors for America's Advocacy Grand Rounds here for July. Today, we're going to be talking about media training and how to write an op-ed. And I just want to welcome you all to the program. First off, I've set up some ground rules for what's going to happen. So number one, there's no such thing as a stupid question. I'll probably be asking a lot of questions myself. So making sure that none of my questions are terrible. I'm setting the rule that there's no such thing as a stupid question. So feel free to throw anything that you want to into Q&A, and we'll get to it at some point throughout the session. The next thing is be aware of the impact over sort of what you're saying in terms of statements or questions raised. Just sort of be conscious of those things. And then remember that for some people, their experience in working with the media may be extremely novice. They may have never written anything like a letter to the editor to a newspaper. They may have never appeared on TV. And there's other people that may be in this session that have actually done a lot of media interviews. Maybe they've been on national or international broadcasts. So be mindful of that when we're talking and conversing with one another, as we may be at different levels in terms of what we're doing. Before we get started, though, with this program, I do want to put in a nice plug for DFA's National Leadership Conference. It's going to be August 6th through 8th. So it's just about a month around the corner. It's virtual, so it's easy to attend. And for physicians, the price is about $299. It's cheaper if you're not a non-physician, if you're a student, if you're an advocate, some other non-physician profession. So please sign up for DFA's National Leadership Conference. We're having a great lineup of speakers, and those are being finalized in the next couple of weeks. But we're expecting a great lineup and some great tips on how you can become a better advocate for your patients, something like what you're going to learn here today. So let's start out with a quick little set of polls just to learn a little bit about everybody. We should be putting up a poll now talking about where are you guys from. So number one, are you from the Northeast, the Southeast, the Midwest, the Southwest, the Northwest? I'm in Texas. I don't know where that actually goes. You need a separate box just, I think, for Texas, because it's not really the Southwest. It's not really the Southeast. But for all you Texas people, you know who you are. Another question we want to know, is this your first Advocacy Grand Rounds with DFA? Tell us, how comfortable you are with talking about the media, and then how comfortable you are with the thought of writing an op-ed. So we'll just give a few minutes for those poll questions, and maybe we'll get to them throughout the discussion. Throughout the course of the hour, we'll get to some of those answers. But for now, I wanted to give you a quick little rundown of who we have to speak to us today. Okay, we'll go ahead and do that really quickly, and then we'll kind of jump right into the content. Okay, so first off, Dr. Dorothy Novick. She's a clinical assistant professor of pediatrics at the University of Pennsylvania's Perelman School of Medicine, and attending physician at CHOP, that's Children's Hospital of Philadelphia. Her advocacy and clinical work is around violence prevention and trauma-informed care and social determinants of health. She serves as a practice-based scholar with CHOP's Center for Violence Prevention, a board member of the Education Law Center in Pennsylvania, and an alumni ambassador for the Op-Ed Project. Dr. Novick has written extensively about gun violence and childhood trauma, as well as a range of issues affecting the health and safety of families in her care. She received her MD from Yale and completed her pediatric residency program at CHOP. And then we also have Alex Strauss, who is a published author and an award-winning healthcare journalist with more than 3 decades of experience in various types of media. She's the co-founder and owner of Med LLC, which has been disseminating medical community news for healthcare providers in the upper Midwest since 2010. She's a former television healthcare news reporter and an anchor, and Strauss has such written for national and international news outlets, including Newslink, MSNBC, NPR, BBC, and The Guardian. She's the managing editor of Cancer Monthly, the daughter of a pediatrician, so she gets us physicians, and a frequent speaker on the intersection of medicine and social media. Her MA is in broadcast journalism and public affairs from American University. So now you know a little bit about our speakers. We're going to get started. And I think we'll start with Alex Strauss. She's going to give us a little introduction about how you, as a physician, can become well equipped to deal with talking to the media.
Thank you so much, Cedric. I really appreciate this opportunity. This is one of my absolute favorite topics to speak on because, as Cedric mentioned, my dad was a physician. I work with physicians all the time, and I recognize how important, more important than it has ever been, for your voices to be heard, and to be heard directly, and to be heard accurately, and to be heard a lot in the media. So that's what I want to help you with a little bit today. The good news is that survey after survey shows that the public trusts doctors more than any other source of healthcare news, of medical news, more than the media, more than public health experts, more than anything that they find online, right? So I really want you to remember that this isn't, anytime we're talking about approaching the media or going out there for an interview, especially if it's not something you've done a lot, it can feel almost like you're like asking somebody for a favor, like you're asking them, like, will you speak to me? You know, like, will you let me talk about this? But I really want you to think in terms of this. Your voice is really needed now more than ever, and the public wants to hear it. And media outlets know this, so they want to talk to you. They're looking for content. Okay, so that's the first thing that I want to put out there. However, I also have some bad news. And the bad news, as you probably already know, is that a lot of the folks who may come to you for an interview, reporters and journalists, don't necessarily have a lot of medical knowledge themselves. They may not even have even the teeniest little bit of background. So it's important that you approach any interview opportunity from the standpoint that you need to feel like you're educating the person that you're talking to, but in a gentle way. And we'll get into that in just a second. So if I could have the very first slide, please. The thing that I want you guys to take away from this presentation today, the takeaway message, is that if you do not set the agenda for your chat with the media. This is actually the first slide, but that's fine. You don't need to change it, Allison. But the thing I want you to take away is, if you don't set an agenda, meaning knowing and being ready to clearly express the central points on your subject, then the interviewer is going to have to, because every article or story needs a focal point. So everything I'm going to talk to you about in the next couple minutes is about helping you know how and also feel confident about setting the agenda, right? So those are the 3 points that you can see there that we're going to discuss: how to land an interview, how to prepare for an interview, and how to conduct an interview. Now, I'm told that I have 12 minutes today, and I've already taken up like 3 of them. So each one of these could be a long thing in and of itself. I'd like you to just put me back on camera for just a second, if you would, please. I'm not quite ready to get into that yet. So what I want to reiterate, though, is that setting the agenda does not mean I'm advocating bulldozing through interviews, talking over an interviewer, trying to assert too much control before, during, or after the interview, giving them questions to ask you, trying to tell a journalist how to do his or her job, asking to review the article when that has not been offered to you. These things are not perceived well by the media, and trust me, it will not serve you. You might get the opportunity to do some of these things, but you won't get called back, right? And what we want is for you to set up a relationship with your local news outlet, so they'll call you back. So they'll think of you as the go-to person when they have a medical question, okay? Setting the agenda does mean clearly expressing the topics ahead of time that you're prepared to speak on. Letting the media know what your areas of expertise are, preparing your thoughts or your talking points ahead of time so you can stay on track, because it's intimidating when there's a camera or a microphone in your face, and staying on point and reiterating that point during the interview. Okay. So in terms of how to land an interview, as I said, media outlets need content, and the public craves healthcare news and medical news now more than ever. Not just because we're coming out of this pandemic, but this has always been the case. A year ago, it was the case. 2 years ago, it was the case. Health and medical news is very high up in terms of what people want to know. And the media outlets know this, so they need the expertise that you have. So to land an interview on the topic of your choice, your area of expertise, media outlets first have to know that you're available, right? Your local person needs to know that you're available and that these are the areas that you know how to speak on, and that and how to get in touch with you. So I recommend that you decide what you're available to talk about and then reach out to them. And that's just as simple as an email and a follow-up phone call. And I believe at the end of this presentation, you're actually going to get that template. If I'm right, I've put together a little template for you that you can use and just fill in your information and send it to your local health reporter to make it super easy to do that reach out. And it's always best if you can hand to the person a hook or a reason why now is a good time to talk about your topic. So if you've already had some experience doing some interviews with your local media, whether it's the newspaper, the TV, or local radio station, whatever it is, keep an ear open for a way to connect what's currently happening in the news with something that you want to talk about, right? Something that you have expertise in. I see that they've just put up a link to that letter that I put together for you. So you can click that link and download that and just fill in your information and go. Okay, so the next thing is preparing for an interview. The most important thing here, guys, is do not assume knowledge on the part of the reporter, unless it's CNN. Most reporters, especially local folks, are on tight timelines. They may come to you with very little background. A lot of times they were just like handed a piece of paper on the way out the door, and that's all they've got to go on, right? And so I want you to, next time you're in this kind of situation, or the first time, imagine that you're talking to a patient, because you are. Right? And so just as when you're talking with a patient, you're not going to condescend to that patient. And reporters don't like that either. So I'm going to get a little bit more on that in just 1 second. And can somebody tell me kind of what my time is? Because I don't want to take up more time than I'm supposed to, but I could talk on this all day. The other thing in terms of preparing for an interview is to know who your audience is and what form the article is going to take. Okay, so that's an important thing to know in advance so that you can speak to that audience, right? If it's an audience of mostly women, okay. If it's an audience of older people, you need to know those kinds of things. Decide on your critical key messages, and then what you want to do is have some talking points written down on those key messages. This is really important. As I said, it can be intimidating when there's somebody in front of you. You have a world of knowledge on your subject matter, and see, here I am talking a lot on my subject matter, and I even have talking points. So I really want to encourage you to just have a few things, a few critical points, and return to those points. And I think that what I'll do in terms of conducting an interview, sticking to those main points, when you're in the interview, go back to those talking points and don't be tempted to go way off script. One way, or a couple of ways, to reiterate your key points, and if you're able, Allison, to put up the very last slide, these are some good examples of ways to simply reiterate your key points in an interview. Okay, I don't think that's the last slide, but I can refer to this slide. It is inappropriate to ask the reporter, what questions are you going to ask me? Or to say something like, I'm assuming that you know all about, whatever, or I'm assuming that you know what X is. Okay, just don't assume. It's more appropriate, just as you would say to a patient, did you want me to tell you about X? If they don't ask that. So if they don't ask the thing you want them to ask, then say that, Did you want to know more about X? Because I think that's important. I do feel like the most important thing to get across to your audience is X. Would it be helpful if I gave you a little background information on X rather than saying like, do you know about, or I assume you know about blah, blah, assume they come in with some knowledge. Don't assume. Say, would it be helpful if I gave you a little bit of background on this so that you could understand? And then if you have that final slide, okay, summarize again. Here is a great place to take a cue from politicians, right? No matter what question they get asked, they come back to their main point, and it's really so critical and actually helpful. And pro tip here, if you use any of these kinds of statements as you're talking about your subject in that interview, you're actually more likely to get quoted directly, because reporters love to be able to use a nice pithy thing like the bottom line is blah, blah, blah. Or, I think really the take home message for people is blah, blah, blah. I think what it really comes down to is blah, blah, blah. Like these are the kinds of quotes that interviewer is going to just grab and run with. And so if you've got these, you can even make a list of those on the side of your paper if you need to, and come back to them as a way to come back to those points over and over. And I think my time is up, and I hope that is helpful. The bottom line is, if you don't set the agenda and you don't do a few things ahead of time to prepare and to be ready to reiterate your points, then those points are going to be, then the reporter is going to have to pick them and set the agenda his or herself. So I hope that's helpful.
Thank you very much, Ms. Strauss. Before we switch over to Dr. Novak, I did want to see if we could get those poll results up so I could take a look at some of them and see where everybody's from and what their level of comfort is, if we have a minute or two to pull those back up. Let's see. Looks like geographically you're spread pretty well. Most people, 4 out of 5. This is your first Advocacy Grand Round, so thank you for joining us at DFA for that. It seems like most of you feel somewhat comfortable with talking with the media, so let's try to get some of those folks pushed up into the absolutely comfortable with talking with the media standpoint. And then Dr. Novak's, most people feel okay with doing an op-ed. Can you tell us how to make that op-ed spectacular for them?
Absolutely spectacular. Thank you so much. Thank you, Alex. That was excellent. And I think one thing I haven't heard Alex is talk before, but there are a lot of similar themes between what we both have to say. So I think that's really interesting and really valuable. And thank you to everyone for coming and talking with us about these ways that we as healthcare providers can really use our voices as advocates for the patients and families that we care for. I started writing as a way to really try to translate my sort of grassroots experience into a larger voice and try to share some of the things I've learned as a pediatrician in ways that could potentially raise awareness and move change forward. So we're going to jump right in and talk about some of the things that I have learned to keep in mind when I'm writing an op-ed, and hopefully these will be valuable to everyone as well. So you can go ahead and put up those slides. We'll just skip to the next one, please. So I try to boil this down into sort of 10 basic concepts. And if you go ahead and pull the first one up, the first one I think is incredibly important is you have to have passion for the thing that you're writing about. If you are someone who's sort of opening up your laptop and thinking like, oh, I'd really like to write something, what should I write about? Basically close your laptop again. What you should do is wait until there is a problem that you absolutely cannot stop thinking about. Maybe something has happened in the news or in your own practice. It might be an example of a bigger problem in healthcare or society or the world at large. And if this thing is keeping you up nights and you cannot stop thinking about it or talking to your friends and family and colleagues about it, that's when you want to put pen to paper. I'll give just one example, early on in the pandemic, this was probably maybe the second or third week in March, I saw a woman in my practice who had COVID, who had already been diagnosed with COVID and was quite ill. And she came in because she was bringing her baby to be seen because the baby now had symptoms as well. And the baby, thankfully, clinically was fine. But as the visit progressed, she and I realized that she was going to have to go to the hospital. And there was absolutely not a single person on the entire planet who could care for her baby because the baby now had COVID and was contagious. And it was really the first time I can remember as a healthcare provider being just completely dumbstruck. Like there was absolutely not a single solution that I could think of to offer her. And I couldn't stop thinking about it. And I just sort of had to get it out on paper to really try to prompt us as a healthcare system to think about and create solutions for other families who are undoubtedly going to find themselves in the same situation. So it should be that kind of thing that you can't stop thinking about. Number two, it looks like it's already there, which is to really try to be timely with the topic that you're writing about, which is not the same thing as having a hook or a lead. And I think it's important to kind of separate out these two concepts. There's a lot of discussion in op-ed writing about making whatever it is that you want to say feel timely. As healthcare providers, I actually think this is less of an issue for us because if there is a thing that is really actively affecting the health and well-being of our patients, chances are it's timely because it's affecting the health and well-being of a lot of other people as well. So timeliness, I don't worry too much about, but it is important to think about what is that lead, what is that hook, what is the thing that's making me want to write this or make this point right now. I find that hooks for me usually come in three different varieties or categories. The first is an experience I'm in clinical work. That's an example of a larger issue like this baby who was contagious with COVID. The second, I would say, is an important new study, potentially with far-reaching implications, because I think as healthcare providers, we can really do an enormous service by communicating timely information from the scientific literature sort of out to the world at large. The third one is a current event, and this is a pretty common one for me, something that either is directly affecting my patients, like a new law restricting access to certain kinds of healthcare, or something in current events that is sparking me to think more deeply about problems I already see at work every day. So, for example, during the Larry Nassar trial, I became acutely aware of how often parents say to their children, as I'm about to do the dental exam, parents often say, "It's okay, you can trust Dr. Novick, she's a doctor." And of course, he was a doctor too. And every time they would say it, I would sort of get this like sinking feeling. And I really began to think a lot about how can I teach my patients to know what is and is not okay during the dental exam so that they can recognize when they're unsafe. So I wanted to put that on paper so others could sort of learn from this series of just horrific tragedies as well. And I would say also, if there's a thing that feels like it's a big enough issue that it is keeping you up at night, chances are if it's not in the news today, it will be very, very soon. So my advocacy work, as Cedric mentioned, is mostly centered around violence prevention. And I really wanted to write about unintentional shootings in children. So I crafted a piece, and then sure enough, I mean, within, I think, 2 weeks, a 3-year-old little boy shot and killed his 9-year-old cousin in Philadelphia, where I live. And so there was my lead. Number 3, I think it's already up there, is the idea of telling us upfront why you are a person who knows a thing about this subject. So I participated in a workshop by the Op-Ed Project years ago, and I'm now sort of an adjunct instructor with them. And they do a really fabulous job of helping participants see that expertise can come from a wide variety of sources. Many of us think about professional expertise, like I have a lot of initials after my name and I, went to a fancy institution, or, I've done like the world's most important research on a thing. But it's also important to realize that expertise often comes from our own lived personal experiences or professional experiences. So whatever the reason that your perspective feels unique or important, you want to announce it early on in your piece so the reader understands that your voice, really matters in this area. So that sounds like, as a nurse on the front lines of this pandemic, I have seen, or when I arrived to this country at the age of 8, I learned what it meant. I mean, it can really be any of those things. I would basically say the only time this is not necessary is if your name is widely known to every single person who's going to read that piece. So like if you want to write about COVID and your name is Anthony Fauci, you don't have to say why you know about COVID, but if your name is anything else, you need to say why you know a thing about COVID. Okay, number 4 is the preview. I find this one stylistically actually probably the most challenging thing to do. It's the idea of somewhere right up front before you really get into your argument, say in one sentence or two what your piece is going to be about. And it can feel awkward because you haven't even developed your argument yet, and you certainly don't want to jump to the conclusion, which is going to be your call to action. But it's important to give us a sense of where we're going. It kind of helps ground the reader. So recently, for example, I wrote an op-ed, or I left this out initially, and it was my editor who was like, you have to put this in. And it was really helpful because the op-ed opened with these horrific statistics about children dying from gunshots during the pandemic. And the reader at that point may have assumed that I was going to be talking about the effects of trauma on families, which I have written a fair bit about before, or on the need for extreme risk protection orders, or on the shortage of blood supplies that were needed in the trauma bay. I mean, it could have been going any direction, but it was going to be about safe storage. And so my editor had me say right up front, as a pediatrician, it is my role to focus on preventive strategies that keep children out of the line of fire. And so there, now the reader knows, like, where are we going? Okay, number 5 on the next slide. So now you're going to get into the bulk of your argument. And the first thing is, as you develop this argument, you want to really have a laser tight focus. Most op-eds are only 800 words. So it's very important to be able to be concise and really boil down your thoughts. I do this by keeping 2 things in mind, and I'll just go through them quickly one at a time. The first is to absolutely, as Alex was saying, stick to the message that you're trying to send. So, you know, when this 3-year-old killed his 9-year-old cousin, there were a lot of things that I really wanted to be able to scream about. You know, the father, for example, who was formerly convicted of a felony, had 2 loaded firearms in his home, which he wasn't legally allowed to have. And the 12-year-old brother was arrested for having influence in this event because he was the one who actually found the gun and gave it to the 3-year-old. And I was just horrified by both of those things, but I really had to peel those thoughts away, because the point I was going to make in this op-ed was about holding adults legally accountable for leaving unsecured firearms in the home. And that doesn't mean I won't also write about straw purchases and juvenile justice reform, because I will, but I sort of put those into a different file to save for my next op-ed. And the second way to really try to boil down your piece, in addition to honing in on one message, is to remember that hyperlinks are your friends. So instead of long paragraphs giving a lot of background about each point, which we want to do as, you know, as academics and professionals, it's important to consolidate each point into just a few sentences, and then provide links to all the articles that gave you all this valuable information, so that people who want to go further in depth can do that if they so choose. So it's a deliberate march. You want to keep this laser focus and march directly to the end, which is going to be your call to action. Okay, number 6 is to use really short, clear sentences. Remember that people will be skimming. So the more direct you can be, the easier it'll be for your reader to pay attention and kind of stick with you to the end. So break up your sentences every time, not every time, but I'll say make most of your comments into periods and start a new sentence so that people stick with you. And break up paragraphs as well. If you read a good op-ed, you'll see that many authors take an impactful sentence and actually remove it and put it all by itself, you know, to make its own paragraph, because that's how it can really have the greatest punch. Okay, number 7. So presenting a counter argument, this is what the folks at the op-ed project like to call your to be sure. And the idea is that you want to present the devil's advocate position. Think about, if you were a reader who disagreed with what you were going to say, go ahead and bring his point out and then prove him wrong and sort of undo that argument. So for example, my reader in my safe storage piece would probably say, we don't need these laws, we just need better mental health treatment, or we need to educate kids to stay away from firearms. These are arguments I hear all the time. So in my piece, I wrote, to be sure, you know, safe storage legislation alone cannot entirely solve this problem, but it can make an enormous difference. And then I went on to give statistics showing that states with child access prevention laws do see reductions in unintentional death and injury in children. Number 8 on the next slide. So now we're going to start wrapping it up. Just as Alex said, I think it's great to sort of refer back to your original story or hook. It just kind of adds heart to your piece and reminds the reader, you know, why you're so passionate about this issue. And then number 9, not necessarily in this order, but number 9 is your call to action. Your call to action, of course, is sort of like the final point you're trying to make. And I think there are 2 things I'd like to say about the call to action. One is, be sure, as Alex and I have both explained, to keep it down to one call to action. for the reasons that we've already discussed. Number two, and this is something that I've sort of evolved in my thinking over time, and it's sort of, I think, my own personal style, is to try to avoid the word must. I used to always say must, like Congress must do this, the president must do this. But, I began to notice the way I would bristle every time Epic told me I couldn't close a chart because I must click a button instead of sort of like reminding you to click a button. And I really got me thinking about the way a reader would sort of potentially bristle also being told they must do something. So instead of must, I think it can be equally strong or even stronger just to say what needs to happen for you to best do your job or for your patients to stay alive. So, I ended my safe storage op-ed instead of saying like we must pass these laws by saying my young patients need every state in the nation to enact safe storage laws. Their lives depend on it. So it's more about them than me telling people what to do. And number 10 is the last sentence. You want your last sentence to take our breath away. Like this is a sentence that's going to make everyone click that little tweet symbol and share your article with the world or make a hashtag out of it. And I think I'm going to pull on an incredible op-ed that Cedric Dark, our amazing moderator, wrote in the Houston Chronicle after the NRA tweeted out that gun control was not the business of healthcare providers. And the way Cedric ended his article, I literally got chills when I read his last sentence. He said, in response to the NRA's demand that we stay in our lane, we want to make one thing clear. This is our lane, right? Like it totally gives you chills. And this is our lane became a hashtag, a symbol of our passion, and prompted thousands, maybe hundreds of thousands of healthcare providers to really rise up and use their voices. So you want to go out on like a really strong note like that one. So that's all I have to say for now. I'm happy to answer any questions.
All right. Well, thank you very much for that. And in all fairness, I'd have to say it was the 32,000 people that already were using the "This Is Our Lane" hashtag, and we're just coasting in on all of the.
Oh no, you could have taken credit.
I could take credit, but I'm not going to take credit because it was a collective effort by everybody in the House of Medicine speaking up specifically on that topic and speaking out about the NRA and how ridiculous they were in attacking the House of Medicine. So kudos to everybody that has done that. Well, I have a few minutes here, number one, where I wanted to ask each of you a couple things and just highlight a few things that you had said. So Alex had mentioned in her comments, one word that stuck out to me was pithy. And I've heard this before, kind of keep your commentary to reporters short, sweet, and hopefully memorable, essentially. So that's one thing I wanted to pull out just in case for those of you that were listening, if you didn't get that point, that's something I've heard before. And I think something that's worth reiterating. And then kind of when I was listening to Dorothy's talk on how to write the op-ed, and I kind of like the idea of being the devil's advocate in your own writing so that you can counteract the counter arguments. It made me think about being in the ER and getting that MICU consult for that borderline patient, because I know that they need to go to the floor. I know they don't need to be in the ICU, but having done a prelim medicine year, I also know that the hospitalist is not going to want them on the floor without somebody else's blessing. So kind of getting that off at the pass is a little helpful. And then the second thing about being timely, it's really unfortunate, I think, when we're talking specifically about gun violence, is that you're able to write something in advance and just put it in a drawer and wait, because the next mass shooting's around the corner. The next accidental child shooting their sibling is right around the corner. So there are some things that we can call evergreen that kind of come up over and over again, and you can start writing your op-eds now so that they're ready for when the time comes that the news cycle cares about them. So those are a couple of thoughts that I had from listening to the two of you. And I see there's a couple of comments that are out there or questions in the Q&A. And I think maybe we can start off with those actually before I get into some questions that I have for you guys as well. So for Dr. Novick, the first thing, the question that's out there is, how do you choose which affiliation you use? Who are you representing when you're writing an op-ed? Do you use your academic affiliation? Do you mention CHOP? Do you mention the university that pays your salary, or do you use something like DFA? for that affiliation, or do you just say you're a doctor in Philadelphia?
I've done all those things, and it's a slightly complicated question, or not a complicated question, but complicated answer, which is that it depends very much on your institution. So in my institution, they feel pretty strongly that if they're going to be cited, that they would like to sign off on whatever it is I'm writing. So if it's a piece where I feel that having the weight of that affiliation behind me would actually help lend expertise and make the piece stronger, then I certainly do want to, be sure that, they agree with what I've written and that they are happy to have that affiliation listed. If it's a piece, if I were writing something, that had really nothing to do with my work at CHOP, it might not feel as important to include them in there. Every time I'm writing about gun violence, I always cite CHOP Center for Violence Prevention, where I'm a scholar. So if I'm writing about advocacy, I would certainly cite Doctors for America as well.
All right, and for Ms. Strauss, what would your advice be for physicians as they work with journalists in terms of how they represent themselves as either part of a university, a hospital, or should they say something like as a member of DFA, something like that?
Yeah.
So how do the journalists perceive the requests that we have as physicians for our affiliations?
I don't think most of the time a journalist is not going to care. I certainly never, it didn't bother me who you want to say you're with. The thing that's important to me as a journalist is your credentials, right? Is your expertise, is the fact that you are a fellowship trained, whatever. So because that's what my audience is going to glom onto, is the fact that you know what you're talking about, right? So it doesn't, I think what Dr. Novick says makes complete sense, and you really got to go with what you're talking about. And if you like, there's a Center for Violence Prevention, and talking about violence and being affiliated with that certainly adds weight, as she said, to your remarks. But from the journalist standpoint, I really don't think it matters.
All right, well, thank you for that. Before we go any further, I wanted to make sure that you all know one thing. Doctors for America lives and thrives on donations and contributions. And we really, we're not able to put out programs like this for free without you all being able to provide donations and pay for membership. So if you have a chance, we're going to put in our chat the link to donate, which is www.doctorsforamerica.org/donate. So if you have a chance to throw a few bones our way, please do, because it helps with programs like this. So, all right. As we continue moving on, if you guys have questions, please throw them into the Q&A so that we can address them. I have a few other things I wanted to ask our panelists, and I'll pepper your questions in there as well. Dr. Novick, did you raise your hand?
Just speak to let you know that there's also some questions from the audience in the chat.
I'll take a look at those and we'll pepper those in as well. So let me see if I can get started here. One thing that I think we talked about a little bit in the prep of this was maybe media coaching. Dr. Novick, do you have a media coach? Mm-hmm. If so, how'd you find them?
Now her name is Alex Strauss, and she's
yes, I'm very happy to work with you.
No, I don't have a media coach, and I think it's a fantastic idea, and I really will be looking for one. It's really useful.
I'll give you my number.
Well, as a media coach, Dr. Strauss, do you have any other tips that you'd want to give us real quick?
Well, let me look over my talking points here, because I did skip over a couple of them. I don't necessarily mean, as I said, this is a topic that there's a lot to unpack, right? And as you pointed out when we were prepping for this, there are different nuances depending on if you're doing a newspaper interview, or if you're doing something for television or the local radio station, or if you're being interviewed live as opposed to being interviewed for something that's going to, air later and that kind of thing. So I'm happy to answer specific questions, but I without really knowing kind of what the audience wants to know, I don't want to just spout a bunch of stuff. I think, again, that message that I just want to get to everybody is that it's really important to take a couple of minutes to prepare. I will tell you that as a journalist, there were times I'm not anymore in television, but I was for years. I was the TV health news reporter for many years for my local TV station. And there were many times that I showed up for an interview better prepared than my doc was. I had done my research. I had done some background as fast as I could in the days before the internet. And I'm like, finding as much as I can and reading as much as I can on the way to the interview and trying to, so that I can ask intelligent questions. And then the physician would just like come out of the patient room and come into the office and be like, okay, so what do you want to know? What are we talking about? And that is not the way to have the most impactful interaction with the media. And then it's definitely not the way to help educate the audience in the way that you want to. So it doesn't have to be like, you don't have to spend an hour making a big old presentation, but I do really strongly feel that if you take even 5 to 10 minutes and say, this is the point that I want people to really, I want this reporter and this reporter's audience to take away from this. Yeah.
So would you say that the best preparation is preparing your talking points and sort of your soundbite, perhaps?
Absolutely. Yep. Yep. And, soundbite, I don't know. I hate that word. I don't think that it's that important that I don't want people to feel like they have to think of sound bites or think of really super clever things to say. What's much more important is that they express the information clearly on an understandable level to the reporter and to the patient, and avoid using jargon. This is really important. So when you're taking your few minutes to think about what you're going to say to the reporter, remember that patients don't necessarily, audience doesn't necessarily, reporter doesn't necessarily know what edema means, for instance. Just say swelling. You have to kind of dumb it down a little bit, unfortunately, based on your audience. So, kind of keep that in mind as well.
Dr. Novak, do you have any tricks of how you prepare when talking to the media? And specifically, you've done different types of media, whether it's print, TV, radio. How do you prepare?
Very similarly to what you both have said, I really I write down all the things I want to say and then I boil them down into specific bullet points. And the one thing that I would add, and forgive me if you mentioned this, but I don't think I heard it, is it has helped me also to know what the landmines are that I need to avoid before the interview, because there are times that, a journalist might sort of, want to get a certain opinion from me that I'm not prepared to offer, or that my institution is not prepared to offer, and I'm speaking partly on behalf of them. Either way, I do think it's important to be sure you're clear on what you don't want to say.
Yeah, that's an excellent point. Yeah. And I think there are definitely ways to skillfully get around that. If there's a question that feels uncomfortable or that you're not prepared to answer, I think it's perfectly fine. The person across the table from you, across the desk from you, is just a person, and it's perfectly fine to say, that's actually a question I'm not prepared to answer today.
And I've done that. I said, it's really not my place to say, whether schools should or should not open. But here's what I know.
Exactly. Rather than stammer around and feel like you have to kind of come up with something, it's perfectly fine to say, not going to answer that, So.
Dr. Novak, let me ask you this, because your slides seem to make that op-ed writing super easy. Is it as easy as you make it seem? And what kind of pitfalls do you think are there? How can you get people to get over that hump from thinking about something to actually writing it?
Well, I think, the part that I personally find the most challenging is really sort of the actual structure. I think having the passion, knowing what we want to say, finding some data and some personal experience to, explain tell the story is not the hard part. What I find the hardest part is actually sort of what order to say things and how to march them out. And that's difficult when you only have 800 words usually. So it usually takes me a good day or more to play with all the different, orders of the paragraphs so that they, make the most sense as the reader is moving through it. And I guess my message there would be, don't be discouraged. That's normal.
And then sort of follow up on that. I know I've written a lot of op-eds, but I also have a lot of things, probably even more than have actually been published, that are just stuck in a drawer, stuck in a file somewhere. Is that a common thing for you too? So that people don't feel discouraged that what they've written doesn't see the light of day.
Yeah, absolutely. And I think you really hit the nail on the head when you said, almost always, there will come a time that's right for that piece. And even if you've only written it halfway, I try to, if I start something, I only get one paragraph in and I just get discouraged or decide I don't have the time, or it's, not the right time in history for this, I always label the file and just leave it there so that when I need to go back to it, it still has that heading on it and I can pull that back out.
Okay, let's swing a little bit to talking with reporters again. Because I think one of the things that people are expecting when they're speaking to a reporter is that they'll probably be quoted. But there are also different sorts of ground rules, I guess. Sometimes you can talk to a reporter on background, sometimes on record, off record. Rarely have I seen it happen, but occasionally in the pandemic, I've known some of my friends getting quoted anonymously because we feared for our jobs and talking about sort of the short supply of PPE. Can you explain, Ms. Strauss, a little bit about those sort of ground rules at that interaction with the reporter when you're a physician?
So, yeah, that's an excellent point, Cedric. I had this in my talking points and I had to skip over it for time, but always assume from the second that reporter walks into your office or you pick up the phone and there's a reporter on the other end, from the moment from the moment anyone walks into your office to interview you, the interview starts then. I would absolutely not, that period, anybody who's done any kind of press interviews knows there's a period where you're just kind of chit-chatting and somebody's setting up their microphone or their camera or whatever, you having a good day? Yeah, what's whatever. Okay. There have been a number of times where there is necessarily no delineation, because partly, and that's not to be sneaky, but partly the reporter, the interviewer wants to put you at ease, right? They want you to feel comfortable. I've seen it a million times when I'm chatting with the doc and just, my camera guy was getting set up or whatever, and we're getting comfortable. And then I start asking a question and then they're like, oh, is this the interview now? Yes. Okay. Now's the interview. So now they're stiff. Now they're self-conscious. Now they're futzing with their clothes. If I can just not do that and just keep talking and just keep kind of going it, then a lot of times they're a lot more relaxed. Okay. So this is a technique that reporters use, and it is not meant to necessarily be sneaky, but I really want you to remember that unless you specifically say, as Cedric said, this is not on the record. Okay. Turn off your camera, turn off your microphone, whatever, put your pen down. This is not on the record. This is strictly background. I don't want you to quote me on this. Okay. That's fine. And the reporter acknowledges that. Yes. I gotcha. Other than that, it's on record. It's all on record and it's all being recorded. Does that make sense?
To steal a phrase from Law and Order, anything you say can and will be used against you.
Can and will be used for the betterment of people's health, right? Not against you. Presumably, You're going to talk about good stuff.
We're going to talk about good stuff, but we've all seen like the problems with people with hot mics and all this other kind of stuff too. So
that's why I say that. Yeah.
Yeah, be careful out there when you're talking to anybody, even on like a DFA webinar, essentially. Quick question for Dr. Novick. You talk about incorporating data into your pieces. And my question is, how do you communicate numbers and statistics to lay people? Because I've seen, especially over the course of this pandemic, there's been a really difficult time trying to explain scientific concepts to folks, and they get misunderstood really easily.
Yeah, I agree. And I think it's also important not to have too many numbers, because for a lot of us, the reason that our voice can be so powerful is because we also have such personal experiences with a lot of the things that we're writing about. So I think it's important to say those numbers because they need to be out there, and then to very quickly kind of translate that data into people's real lives. And so I try very hard to usually have those things right alongside each other. So 5,000 children have been injured or, have been killed by gunshots in 2020. And then I right away tell a personal story about the impact of that on a family.
All right. We have a question in the Q&A. Just advice for handling live interviews, I guess, as opposed to, something that seems more prepared when it's going to be either recorded or if it's going to be in print. And I certainly know from personal experience, doing live interviews does give you a little bit of nervousness. Feel a little bit more comfortable when you're doing something where maybe if you flub a line, you can say it the second time and maybe they'll take a better take on it. Any advice for that?
Any advice for live?
Yeah.
Prepare. Be prepared and have those talking points in front of you. The best way to deal with nerves, anyone in that situation is nervous. I was nervous preparing for this, getting ready to talk live to you guys. So the very best way to make your points clearly and to not flub a line is to just have those talking points ahead. And, if you have a few minutes, if you have the luxury of a few minutes to actually sit quietly and talk to yourself a little bit, practice a little bit, that can be very helpful as well. But I think the bottom line is just have a few points, have some things written down. As Dr. Novick says, write them down. Don't just assume because you know everything there is to know about cardiology that you're going to be ready for any question that's going to come at you or for anything. I say, have your points, know your audience, and be ready to reiterate those points.
Yeah, I would agree with you. I think that those are extremely good points. And especially talking it out beforehand. I've done several live TV interviews, but before I go on, I probably try speaking them sort of as a mock interview in my house when no one's listening several times to get the rhythm down, to get the words out of my mouth in that fashion. So thank you for that point. This will probably have to be our last question because I think we're starting to run short on time. This one's from the Q&A out there talking about confidentiality issues when you're talking about patient cases, either writing about them or speaking about them. So I think, Dr. Novick, this one's best for you. How do you navigate discussing patient care without violating HIPAA or violating patient confidentiality?
Yeah, I think that's such a good question, something that I've wrestled with a lot and have found a few different solutions for. I would say there are 3 different potential solutions. One, of course, is getting consent from the person whose story you want to tell. As a pediatrician, I personally don't do that because while legally what I need is the parent consent, I also feel like that child is going to be 18 one day and that child's story is now going to be out there. And it feels wrong to me because I can't really get informed consent from a child. So that I think works well when you're not talking about children. So one is to get consent. The other is to try to speak in a general way. So I can say, when my patients suffer gunshot wounds or, when I talk to my patients about the general exam without necessarily, giving identifying details about a specific situation. And then the third one is if the specific situation really is that compelling that, those details just make the whole story, to change the details and then put a disclaimer saying that certain details have been changed to protect confidentiality. So change the person's gender, change their age, make it a girl into a boy, really be careful to do whatever you can to de-identify that patient. And my communications team at my hospital has been really helpful with this too, because there have been times that I thought I was being really careful to protect the patient's confidentiality. And when they looked over it, they said, it'd be better to not put that in quotes or to, change this thing. So it's helpful to have sort of a double check on that because that's not a mistake you want to make.
Definitely not a mistake you want to make when the feds can come after you for violating HIPAA. So. Well, I want to thank the two of you very much for joining us on this Advocacy Grand Rounds for Doctors for America today. Remember, for those of you that are viewing this presentation, please sign up for our National Leadership Conference next month, April 6th through the 8th, online. And if you're able to donate to DFA, Doctors for America/donate, please, we'd appreciate those contributions as well. Lastly, what I want to do is give all of our participants a way to further engage, because this isn't it, and we alluded to this before. What we want you to do is to pick a local media outlet. Find your local health reporter, and make yourself available to speak to them on whatever topic that is of relevance to you. And I think one of the things that we do so well as physicians is, number one, we can say, I'm an emergency doctor, so I could talk about anything related to, emergency care or summertime emergencies, winter emergencies, that sort of thing. But then also, I have sort of an advocacy focus as well. That is something that I'm passionate about, which for me happens to be things like healthcare coverage, surprise billing, which is something is fairly relevant to not only emergency physicians, but also as a policy topic is fairly relevant too. And so our health reporters that are locally can reach out to me not only for the run of the mill thing, like don't blow your hands off on 4th of July, but can also come to me for a little bit more specific topics that are more policy focused as well. So anyway, what we want you to do is to take this letter, it should be in the chat, write it and send it to your health reporter at your local paper, and copy us at DFA as well so that we can follow up with them. And then there'll be a survey from DFA, I guess, about this presentation as well, so that we can get a little information from you. And if you have more questions and you want to come back later on tonight, feel free to do so. We'll be here again at 8 p.m. Eastern. Otherwise, we'll see you next month for DFA's Advocacy Grand Rounds. Thank you all very much.
Thanks.
Thank
Bye-bye.
you.